Anterior knee pain, or pain around your kneecap, is caused by an imbalance or malalignment of the muscles and bones in your lower leg. It causes pain when you're doing things like squatting, twisting, pivoting, or especially going up or even more so downstairs. The good news is that exercises that you can do on your own at home are often very helpful. Here to show you some of those are our friends from Saco Bay Physical Therapy.
Hi, I'm Gabriel Redmond with Saco Bay Physical Therapy, and Ashley and I are going to show you a few exercises that you can try at home if you're experiencing some anterior knee pain. Typically the patients that we see that have anterior knee pain is because of a combination of muscle imbalance between both the hip and the thigh muscles. So we certainly want to address both while we're working on these exercises. First exercise that we're going to have Ashley perform is a bit of a modified squat for you. She's going to take the ball and hold it between the end of her thighs, and she's going to gently squeeze that ball. What that's going to do is going to engage her adductor muscles, which is one of the major stabilizers of both the kneecap and the entire leg in general. So what she's going to do is she's going to keep a nice gentle pressure on that ball and perform a squat. That looks great. What she's trying to do here is she doesn't want to go too deep. She's going to about 60 degrees of bend in that knee, and that's perfect for this exercise. If you start to bend too deep, what you're going to find is that you're creating a tremendous amount of stress on the kneecap, particularly when you get to about 90 degrees. So keeping that at 60 is what we're looking for to get that healing process going, get the blood flow going. The other nice thing about 60 degrees is when you're walking or running, you typically only need 60 degrees of knee bend anyway, so we're really training these muscles from a functional standpoint. I want to show you a little variation on that squat as well, where that one was engaging the adductor muscles. Now we're going to have Ashley place the band around her knees. What this is going to do is this is going to engage the outside muscle groups of the hips. These are also major stabilizers of the entire leg and the kneecap. Depending on the patient and depending on their knee pain, one of these exercises may be more comfortable than the other. And certainly if you're trying these at home, you don't want to do anything that's painful. That is certainly going to just create a worse situation. Same idea here. She's doing a great job of keeping that knee bend to about 60 degrees, working the muscles, getting the blood flowing, but not putting too much stress on that knee, which again is the area that we're trying to heal. That's excellent. I like how she's using her hands out in front as well. Helps to create a little bit more balance with the squat. A lot of times when people are performing a squat, they're getting the correct knee bend, but their hips aren't getting involved. By bringing the arms out in front, that helps to create that nice balance between the hips and the knees and keep the weight going through the feet in a nice even manner. This next exercise for anterior knee pain, we're going to have you lying on your side. At home, you can do this on the floor or certainly on your bed, especially if it's a nice firm surface. We're having Ashley on her side. Her knees are bent to about 90 degrees. And what she's going to do is keep her feet together while she lifts her knee up in the air. It's called a clamshell exercise. And what this is getting is external rotation and abduction at the hip. And the reason we're doing that for anterior knee pain is those muscles provide a tremendous amount of stability for the entire leg, particularly the kneecap. As you're doing these, they start out pretty easy, but these will catch up with you. 10 to 20 repetitions are typically what we're looking for with these. If they're really easy, you can also add a cuff weight on the outside of the knee, or you can put an elastic band around the knees to add some resistance. However, for the majority of people, just this, the weight of the leg is going to be plenty. And again, I'd rather have a little bit more repetitions than increase intensity when we're talking about rehabilitating an injury.
These exercises are usually very helpful, but if you don't experience any benefit or you get worse over 3 or 4 weeks, you may need to seek some extra help from your doctor or a physical therapist.